Welcome to a new episode of Beauty Times Medicine, our video and podcast series hosted by Galderma. Today, we're honored to be joined by Dr. Philippe Berros, one of the world's leading experts in oculoplastic and reconstructive surgery, based at the renowned Princess Grace Hospital in Monaco, and also the owner of La Clinique Monte Carlo. Dr. Berros is also a trailblazer in aesthetics, known for pioneering techniques and advancing treatments for the delicate under-eye area. His work has had a profound impact on both surgical and non-surgical approaches in aesthetics, and we are delighted to have him with us today. Dr. Berros, welcome to Beauty Times Medicine.
Thank you for your invitation.
I looked at your background. It's, of course, very, very impressive. And I also realized that you've actually worked with Galderma for over 20 years. How did it all start?
You know, I come from ophthalmology. I made my fellowship in ophthalmology, and there's two words which is very important in my life. It's ophthalmology and toxin. You know, because in the field of ophthalmology, there's different departments like cataract surgery, retina, and I was involved since my beginning of my study in Oculoplastic. We start to treat different diseases, and some neurologic diseases like blepharospasmus and Mage syndrome. And this, we use the toxin. And when the industry start to understand that we can manage the wrinkles around the eyes, they were looking from some doctors who are involved in these treatments. And I had the chance to be one of them. And I start since the beginning the story of the toxin in aesthetic field.
It was very interesting. I yesterday had the opportunity to basically listen to a conversation about the history of toxin, and it's absolutely fascinating. And of course, the ophthalmic area played a huge role in introducing, a bit coincidentally, into the aesthetics area. And of course, today, it's absolutely a part of all aesthetics treatment. But you're also based in a particular part of the world, a beautiful part of the world called Monaco. And I had the great pleasure to visit La Clinique Monte Carlo, that is yours. And I would imagine that you are meeting a lot of celebrities, a lot of famous people, probably both from Monte Carlo, traveling in. So how has the needs of these patients, how have they evolved over time?
Celebrity, famous people, everyone say yes to them. You know, the assistants, when they go to the restaurant, they have the table, they can open the shop on Sunday, they can have everything. But health, sometimes they know everything because they have their own doctors in Los Angeles, London, Paris. When they arrive to us, and most of the time from recommendation, and it's like any other patients. First thing is the confidence between your patients and the doctor and the patients. And if it starts, after we have to know how to say no, because if they want too much, or we don't have to change them, we have to improve them, and it's how we have to work with them.
So you early on decided, I read, to work on, I would imagine that's one of the most difficult aesthetics areas, which is, dark areas under the eyes or volume loss under the eyes. And I read somewhere that you earned Best International Paper Award from the American Journal Plastic and Reconstructive Surgery in 2014. This under-eye area, was that your ophthalmic background, or how'd you get into that? Because I think a lot of people, also specialists, are a little bit afraid of it because it's tricky. How did you get into it?
Many years ago, it's true that it was a challenging area because dark circle, teardrop, it was very difficult to manage because we didn't have the product, we didn't have the technique. We know the anatomy, but it's a challenging area with the eyes. It's a functional organs. When you start to work on the area, and because we are ophthalmologists and also oculoplastic, we know the skin, the muscle, everything around the eyes, and it's very important. But when we start to do publication, like the paper we made in plastic reconstructive surgery, we show how to prevent the side effect with the periorbital injection. It pushes you on the top. Also, when you do education, it puts you on the top. So you have to be more and more better in your practice. And what's changed is, after this paper, is the collaboration with Galderma and our team.
But when patients come to you, because dark rings under the eye, of course, everybody's focused on their eyes. So I'd imagine, do patients also come to you and say, hey, I've noticed these things, what can I do?
When they come, they don't know what they have. They say, I look tired. The first thing is to explain to them why it's like this. And we found something very simple. It's the valley and the mountain. It's the shadow and light. So we explain to them that it's because the fat around the eyes. If you have less fat, we need to inject. So we have not the Restylane Eyelight, but we need to inject something to improve, to reduce, to plan this area. And if you have too much fat, you need to do blepharoplasty. So it's very important to explain to them very simply what they have and what is a dark circle, and then how we can manage it. And then after, you can go to the treatments.
And I know that in 2021, I think you were introducing Restylane Eyelight at AMWC in your home area of Monaco. How has that changed? How has Restylane Eyelight kind of changed treatment in that area?
The patients, they are looking for no pain, safety, short and long result effect. And with Restylane Eyelight, we have this. No pain because with the technique, we use a cannula, which is more safe. We know the technique now. There is no risk for the dark circle treatment. It's not like before. We say it's a dangerous zone, challenging area. Forget this. We have the technique, we have the product, and we have the materials. And it's very easy now to inject around the eyes with a nice result and long result effect. We know that Restylane Eyelight, because of this quality integration, projection of the muscle and the skin, we can manage the shadow. And it can last more than 1, 2, 3, 5 years. When you manage dark circle around the eyes to the patients, they are your patients for all their life.
You are often going to China. You've been going there for a long period of time. How did that start? Were you invited as a professor? How did that all come about?
China starts in 2008, I think. I was in a conference for glaucoma in Hong Kong, and I meet Professor He. And we start to be friends, and he didn't know anything about the aesthetic.
Okay.
So he invited him for the IMWC in Monaco 1 or 2 years after, and he discovered the world of aesthetic. And he said, okay, Philippe, could you come to China? I said, yes. So I visited university, and then we sit and he said, okay, we want to open Oculoplastic and aesthetic department, and I want you to involve in this project. So, and the story starts.
Wow. And you've been going regularly since then?
4 or 5 times a year.
And what's your insight on Chinese patients looking for aesthetic treatments? Are they different than the ones you're seeing in Monaco, or the same needs?
Before you know, they want to be like Caucasian for the blepharoplasty. It's finished. And it's true that Chinese doctors, they have a lot of experience now, and I work with them since many years now. I'm very glad and happy to work with them.
Absolutely fascinating. You must have been one of the pioneers, because today, if you go to China, it's of course, in the aesthetics field, it's lots going on and booming. So congratulations on that. Well, it's been an absolute pleasure to have you here on this show. Thank you for joining us on Beauty Times Medicine. We hope you're enjoying the series, and we're excited to bring you more insights from experts and leading voices from the world of dermatology and aesthetics. Stay tuned on our social channels, and now, yes now, also on Spotify for more episodes and many more updates.